Hi,
Okay.
Dr. PK James. How are you doing today?
I'm doing okay.
Right.
Yes.
I wanted to begin by hearing from you about your program. Can you tell us a little bit about it?
Yes. So we have a program. It's the Chess TB project, where we screen people in 12 districts
Right.
in the country. Yes, and we use chest X-ray with inbuilt artificial technology by Qure.ai. Yes.
Right.
Mm.
And what kind of screening models are these? Are these within the community? Are these with facilities? Or how does that?
Yes, so it is combined. We do both community and then health facility. So in the community, we work with the village health teams to select places. It can be in the market, it can be at a church, at a mosque, railway crossing. So we invite people, whether you're coughing or not, we tell them to screen using the chest X-ray for TB. Then we also at the same time screen at the facilities. Yes, and at the facilities we are stationed at the entrance of the major facilities. So we got that opportunity. So whoever comes in, whether a patient or an attendant or the health worker, we request them to all screen.
Okay.
Yes.
And how does once they are flagged for presumptive TB, what follows after that?
Okay, so once they are flagged for presumptive TB, we sit with them and then request them that we need to now do a sputum test.
Right.
Yes, so we request them to give us a sputum, which we send to the lab. So in the community, especially because most of them maybe are not coughing,
Right.
we have techniques that we teach them how to produce a sputum even if you're not coughing. So then we transport it to the health facility for testing.
That's amazing.
Yes.
And how's it changed? How do you think these programs have changed since you've been using AI-enabled technologies like Qure.ai's QXR?
Yes, so it's changed a lot. Like you can realize, I don't know if it's the same, but in our setting down, it's hard to have a radiologist or radiographer in the places where we work. Majority love the urban settings, yes, and we are in the rural settings. So moving with this artificial intelligence that gives you results in less than a minute has really changed things a lot. Yeah, because in a day we can see up to 80 patients.
Right.
You screen up to 80 at a place, which maybe a person would feel tired or may not be able to do that, or later they might give you wrong results, something like that. Yes, so it's changed things around. We're screening more people.
Right.
Yes, and the turnaround time is really short, which is good.
Right.
Yes.
And are there instances where the AI is able to generate other finding abnormalities apart from TB? And can you talk about what happens in those scenarios?
Yes. So the beauty is it is able to flag if you have an enlarged heart, if you have fluid or water in your lungs, that's the term we use. Then if you have some, we call them balls, which are suspect for lung cancer. So it can flag all that. And when it flags that, even if it didn't tell us that you have TB, we also inform you of that and we refer you to the health facility.
Right. That
Yes.
sounds.
Yeah, and it has helped a lot because we've gotten so many people who, for example, did not know they had high blood pressure.
Oh, right.
But the machine tells us there is an enlarged heart, and once we see anything like that, one of the other things we do is a blood pressure. And we have discovered so many people using that.
And this is both in the community and the facility?
Exactly.
Oh, wow.
Exactly.
And what do you think is next? What are the opportunities to still make things better? Where do we go from?
I think AI is the way to go. Yeah, and I'm happy our local, for example, authorities and what have gotten so much interest.
Right.
Because, for example, in the places where we work, at the facilities where we work, they are requesting, please leave us with these machines.
Right.
Because the good thing, they are user friendly.
Yes.
You don't need to have a lot of education and what. It's just an easy process to follow.
So you're saying training effort is lower?
Exactly. Exactly, because as you will realize, not all the people that we work with, for example, my team are medical, yes, but they can position a patient, they can, so it is, I should say, user-friendly and easy to learn, yes. So for even our local health facilities, it will be very helpful. And the other added thing is the number of hours that it can run. Yes, For example, depending on the number of patients you see, it can run up to around 4 to 5 hours, which is a good thing.
Right.
Yes, in our places where there is no power. Yes.
That makes sense. And if you were to improve, what are some of the opportunities to improve further in these kind of both community and facility-based training models? Where are you saying there's opportunity to still improve further?
Yes, so the opportunities to improve, I think focus has been mainly on the adults.
Right.
So we also need to bring in the children.
Yes.
I think that will also be another great opportunity to improve. Yes.
With children, what do you think are potential challenges we might face when we're focusing on below 15 years of age children?
Yes. So currently we have included children in we're doing below 15, but you have to be a contact of a TB case.
Right.
So we are doing that, but one of the challenges that we are facing is some children do not want things happening behind their backs.
Right.
So positioning, you get it when you're, yes. But otherwise, the software itself is able to read and give us the results. Yes.
All right. Anything else you want to add?
No, I really want to appreciate especially the Qure team for the after-sales services. Yes, there are teams that will call late in the night and they are available to help. Yes, like we all know technology. Yes, sometimes there are teams that you can ask, how do we do this, and they are available to help. I think that's a plus for you. Yes, thank you.
Thank you so much.
You're
Really
welcome.
appreciate it. And,
Thank you.
thank you for sharing your
You're
thoughts.
welcome.
Thanks.